Welcome to Studio Central. I'm Eden Jones.
And I'm Jonathan Richardson. Today we'll be focusing on abortion in Oklahoma and the legislation that seeks to ban it.
This is the special report.
We want Oklahoma to be the most pro-life state in the country.
My body, my right.
I didn't have the money for an abortion.
We're really just pro-child.
Today we will focus on the legislation and its legality.
That's right, the experiences of those who either had an abortion, kept their child, and the adoption process.
And the medical and religious influences how abortions are viewed.
But first, reporter Brady Gray breaks down the Oklahoma legislation that is making its way through the state capitol.
On April 12th, Governor Kevin Stitt signed into law one of the harshest abortion bans in United States history.
We want Oklahoma to be the most pro-life state in the country. We want to outlaw abortion in the state of Oklahoma.
Senate Bill 612 states, unless medically necessary, it is illegal to perform an abortion in the state of Oklahoma. Doctors who are found to have performed an abortion illegally face up to 10 years in prison and a $100,000 fine. However, the law does not go into effect until August of this year. But until then, several other laws are still in the House and Senate, jockeying to be signed into law alongside Bill 612. House Bill 4327 also bans abortions unless medically necessary, but it does allow abortions if found to be a result of rape, incest, or sexual assault. From the Senate, Bill 1503, otherwise known as the Oklahoma Heartbeat Act, only allows an abortion if no heartbeat can be detected. An abortion is still allowed if medically necessary. Punishment for both of these bills is a $10,000 fine. The harshest bill so far, Senate Bill 1553. This bans abortions after 30 days post a woman's last menstrual period. The punishment from this bill, a very hefty homicide charge to those doctors who illegally perform an abortion. But people need to keep something in mind. Lawmakers aren't the only ones who are going to be deciding on abortion this year. Senate Joint Resolution 37, which is very likely to pass, will introduce a state question at this fall election. Citizens of Oklahoma will decide if the Oklahoma Constitution should be amended to state that abortions are not a human right, only something that should be done when medically necessary. For more information on any of these bills, please contact your state representative or senator, or visit oklahoma.gov. From Edmond, Brady Gray, Studio Central.
I spoke with a student here on UCO's campus about her experience when she made the choice to have an abortion and got her thoughts on the abortion ban.
Meet Mac McCleary, a work-study student, once a teen mom, and unfortunately the person left with the decision to go through another pregnancy all alone at the age of 23.
It was unexpected. I just broke up with a long-term boyfriend, but we were talking a little bit before we broke up and messed around. And then I find out, I took a pregnancy test and it wasn't even in the morning when you should, and it was full on like pregnant. And so I lived in a one-bedroom townhome with my child because I was still trying to get where I need to go in life. I knew there's no way I could afford that. So I had to make the decision because it would be beneficial for my daughter if I got an abortion. It would be beneficial for me. And if I didn't have that abortion, I don't know if I would be at UCO. I don't know if I would be graduating this year because it would have been a whole lot harder to have two mouths to feed. My daughter's biological father is not involved, so a lot of the financial things and care, it really just depended on me.
How does it feel to know that now your decision would have been against the law?
Honestly, it makes me angry. It makes me so mad because I was not in a position to have another kid. I mean, it's not fair. It's my body, my right, my body autonomy. I literally made the best decision for my family. And yeah, if all things were well and I had great insurance and I had a great income and maybe had a partner, I probably would go through with it, but I didn't have all that. RCSA grants that I applied for, the last two, have focused around sexual health in Oklahoma. The first one that I was granted focused on the teen pregnancy as well in Oklahoma. So I've used my experience as a gain in education because I'm very, very passionate about it, because I believe that we need to do a little bit more. We need to educate the youth so they have the tools to use them and not have to be in positions like I was.
From Thatcher Hall, I'm Jonathan Richardson, Studio Central.
And Studio Central reporter Brooke Niver spoke with a woman who was pregnant when she graduated high school. This is her story.
When I graduated high school and walked across the stage at my graduation, I was 10 weeks pregnant.
Crystal Greeley's home is filled with the happiest memories of her and her family. But Greeley had a hard decision to make at a young age that was different than your usual teenager.
Back then, abortions cost money, number one. I knew that I didn't have the money for an abortion. Number two, I knew that if I could just get away from my stepdad and out of the house, that I could work and support myself and my child.
Even though Greeley was raising a family, she still found the time to go to school and to help others with similar stories to hers.
I went to college to be a nurse and then went into work in labor and delivery. I did that because I loved the thought of being able to help women of all ages, but especially teen moms.
Greeley encourages young mothers to educate themselves about their options and to not be afraid to reach out to others for help. From Oklahoma City, I'm Brooke Niver with Central Studio.
Coming up, we spoke with a local adoption agency that breaks down the process. Should an expecting mother decide that that is their path? Right after this.
If I could go back and change it all, I would. I think I'm gonna miss you the most. I'm sorry. I'm so sorry. I'm so sorry. Or maybe it's just the little moments. If I could go back and change it all, if I could go back, I would. But I can't.
You can achieve a lot using your imagination. I mean, I don't like to brag, but... Wait, who's that? And why is she all over these achievement awards? But with STEM, the sky's the limit. Shaboom! Use STEM to envision... Okay, I'm seeing it. Yeah. Invent...
Got any ideas?
I've got a few, actually. And create a better world.
Told you she's super smart.
If she can STEM, so can you. Find out more at She Can STEM.
In the land of wonder and awe, you won't believe you see what you saw. Where there's something to do for young and for old, where stories are written and then they're retold. Visit Travelok.com today. Come see for yourself and come out to play.
Welcome back to Studio Central's special report. Gladney Adoption spoke with us about the adoption process and the support they offer those involved in the process.
Gladney Adoption, one of the oldest and largest adoption agencies in the country, handles 65 to 70 adoptions a year. Jennifer Lanter, who's in charge of communications and education with Gladney, says with the new bill in place, services will be expanded.
One thing that Gladney is doing is we're starting a new program, a new counseling program, because we realize that families are kind of in this crisis situation, and we want to be able to provide counseling to women who may be at risk for abuse and neglect for their babies, and hopefully stop something bad from happening before it happens.
While some families are able to focus on preparing for the new arrival with the necessities, Others may be thinking about what to expect in an adoption process.
First things that we do is make sure that she's safe and not in any immediate danger. And then our goal is just to listen to the kind of resources that she may need, like housing or food, and try to get her connected to those kinds of things immediately if she needs that. Then she's assigned a caseworker, and our caseworker's job is to make sure that she has everything that she needs.
From electric bills to formula, the nonprofit agency provides many free resources for its clients. Lanter said the adoption process as a whole is free.
We do have parents, all different kinds of parents on our website, so she can go through and look at the different profiles of our adoptive families. And then after that meeting, if everything goes well and they want to stay connected, we consider that a match.
But she also says this information is just the tip of the iceberg.
There's a lot of detail in the adoption process. It's not just an easy decision. We always say that we're family for life and that we're here for the whole process. So we're really just pro-child.
This is Logan Gassett from Edmond, Studio Central.
Thanks, Logan. In our next story, reporter Michaela Todd looked into what those seeking abortions could expect after the legislation goes into effect.
What can a UCO student do if they become pregnant and wish to get an abortion? The only option starting in August for those wishing to terminate their pregnancy is to travel to another state where abortion is allowed.
Because of the recent bill that just passed, starting in August, no one can get an abortion in the state of Oklahoma for all cases except for when the mother's in jeopardy. So cases of incest and rape don't count.
Abortion is allowed in all of Oklahoma's surrounding states with the exception of Texas, who has an abortion restriction after 6 weeks of pregnancy. Check the abortion legislation in each state before making your appointment. According to statistics from Planned Parenthood, it says it can cost anywhere between $750 to $1,500 without insurance. Please check with your insurance to know if it will cover some, all, or none of the procedure. With the cost of traveling, it could be a few $100 more on top of that.
You just want to make sure you're being really safe about it. Like, don't try to do anything yourself. Just make sure you're seeking medical professionals.
From Edmond, Oklahoma, I'm Michaela Todd with Studio Central.
Thanks, Michaela. If you are a parent or a soon-to-be parent, our reporter CJ Craig investigated the cost of having a child in the state, as well as what resources are available on campus for students, faculty, and staff.
With inflation rates reaching their highest level since 2008, people are paying more and more for baby supplies, and the costs can add up quickly.
It takes a lot of supplies to raise a baby. From diapers to clothing, it can run up the price at the checkout. In Oklahoma, the average monthly cost for new parents is upwards of $1,600, and a lot of Oklahoman families are feeling that added pressure for mounting costs as well. In Oklahoma, the average annual income is around $57,000, and baby supplies take up a considerable chunk of that, at nearly $20,000 annually. And for college students, that number is even more daunting, since the average annual income for a college student is only about $15,000. The rising inflation costs aren't helping either. Diapers and baby food are just some of the products rising in price, and the price of diapers has risen $2.50 since a decade ago, and baby food has risen about $2.60 as well. For those struggling to afford supplies, there are multiple programs around the state designed to help provide supplies to help ease the economic burden. The UCO Women's Outreach Center has diapers and baby formula available on campus for students in need and is free for all UCO students, faculty, and staff.
And many people around the state are still struggling to pay for supplies. One mother that I spoke to who wished to remain anonymous said that she was spending upwards of $75 a week on diapers alone. And with costs continuing to rise around the nation, the end is still nowhere near in sight. From Midwest City, I'm CJ Craig, Studio Central.
And when we come back, we'll discuss the legal challenges Governor Stitt may face regarding the bills both passed and working their way through the Capitol.
Plus, we take a look at how these bills could affect the McGirt ruling in tribal jurisdiction.
Sometimes the things we do or say can make others feel hurt, excluded, or isolated. Everything you say and do creates an impact.
How am I supposed to save the whole world?
You can't think about saving the world. You have to think about saving one person.
Because of you, someone's entire life can change. You don't have to be a superhero to have a positive impact.
Friends?
Friends.
Hey Bobo, do trees tell each other stories?
I'm sorry. I'm afraid I don't know that.
Hey, why don't we go find out? Listen.
Do clouds take naps?
I couldn't tell you.
Dad, do stars visit their friends?
Look!
Governor Stitt's, Kevin Stitt's signing of Bill 612 will likely face challenges from several pro-choice groups. The Supreme Court once again under review in a case called Dobbs versus Jackson. How could all this impact Oklahomans? New legislation signed into law this month by Oklahoma Governor Kevin Stitt will likely face a challenge in the courts and could also be affected by a U.S. Supreme Court ruling expected to be released soon. The law, one of the most restrictive in the nation, makes performing an abortion a felony punishable by 10 years in prison and/or a $10,000 fine. It goes into effect in August of this year. The Center for Reproductive Rights in New York City has challenged abortion laws across the nation, including in Oklahoma. Studio Central reached out to the center by email last week. While they declined an interview, they did provide us with a copy of a response from its CEO and president, Nancy Northup, who said in part, quote, "The center has sued the state of Oklahoma 10 times in the past decade to protect abortion access, and we will challenge this law as well to stop this travesty from ever taking effect," end quote. If the center challenges the new law, the battleground could begin here in Oklahoma County and involve the state of Oklahoma Attorney General's office. I contacted the Attorney General's office last week, and while they had no one available for an interview in time for this broadcast, they did indicate they would have more information once a ruling from the U.S. Supreme Court is issued in another case concerning Mississippi's abortion law later this summer. That case is Dobbs versus Jackson, Women's Health Organization. Attorneys from the Center for Reproductive Rights argued the case at the Supreme Court last year. It has the potential of overturning 2 previous rulings. Those rulings are Roe versus Wade and Planned Parenthood versus Casey, 2 of the most significant cases affecting reproductive rights in the nation. At this point, then, the future of any challenges to Oklahoma abortion law and that of others around the nation would seem to hinge upon what happens in the U.S. Supreme Court in the coming months. For Studio Central in Edmond, I'm Mari Blair.
Thank you, Mari. And while Governor Stitt is going to face some challenges from pro-choice groups, a challenge he is already facing here in Oklahoma between the state and its indigenous tribe has the potential to further impact abortions in Oklahoma.
McGirt v. Oklahoma was a case, the facts of the case involved a criminal conviction. And the court considered whether or not the state had the jurisdiction to prosecute an Indian who had committed a crime within the boundaries of the Muskogee Creek Nation.
Let's remember that McGirt was about the removal treaties that removed the 5 tribes from their original homelands to what is now Oklahoma. And the question was whether the Congress had done enough to break that promise when it imposed the state of Oklahoma over these tribal lands. The Supreme Court in July of 2020 said the Congress had not gone so far as to break those promises. That's really important.
18 U.S.C. 1151 includes 3 different definitions of Indian country.
So how could McGirt v. Oklahoma and the Supreme Court's ruling on it impact abortion laws that Governor Kevin Stitt has signed into law and is hoping to sign into law soon?
First of all, that requires an assumption that any particular given tribe or tribal government, that there's going to be the political will amongst its citizens for its tribes and tribal governments to facilitate abortion providers within Indian country. There are, aside from the political obstacles, there are other legal obstacles as well. For example, the Hyde Amendment would likely prevent the use of any federal funds, which would rule out provision in Indian health clinics, IHS operations. If Roe v. Wade were to be completely overturned and you were to have a federal policy that abortion is illegal, that might open up the door to incorporation of something called the Assimilative Crimes Act, which basically allows the feds to borrow state law as long as it doesn't expressly conflict with, when there is not a federal statute on point, it allows them to incorporate state law for that purpose. So that would also be a potential obstacle.
Getting abortions legalized in tribal nations would be an extremely complicated task. Governor Stitt was in Washington, D.C. yesterday for the oral arguments in the Castro Huerta case that's in front of the Supreme Court. This case is an extension of McGirt v. Oklahoma as it deals with state authority in Indian country. That's all I have for this. Let's send it back to Jonathan and Eden at the desk.
Thank you, Patrick. Still ahead, I spoke with Trust Women about the danger women will face if abortion is fully outlawed in the state and discussed the views of local hospitals. Stay tuned.
If I could go back and change it all, I would. I think I'm gonna miss you the most. I'm sorry. I'm so sorry. I'm so sorry. Maybe it's just the little moments. If I could go back and change it all, if I could go back, I would. But I can't.
You can achieve a lot using your imagination. I mean, I don't like to brag, but... Wait, who's that? And why is she all over these achievement awards? But with STEM, the sky's the limit. Shaboom! Use STEM to envision... Okay, I'm seeing it. Yeah! Invent...
Got any ideas?
I've got a few, actually. And create a better world.
Told you she's super smart.
If she can STEM, so can you. Find out more at She Can STEM.
In the land of wonder and awe, you won't believe you see what you saw. Where there's something to do for young and for old, where stories are written and then they're retold. Visit Travelok.com today. Come see for yourself and come out to play.
Welcome back. And many Oklahoma hospitals have a strict opposition to abortion, and now many women are left with limited options. I spoke to Trust Women's communications director to hear his thoughts.
We want Oklahoma to be the most pro-life state in the country.
While the battle over abortion access is playing out at the state capitol, it is a debate that has also spilled into the medical community. The new Oklahoma law means the state will have one of the strictest anti-abortion bills in the country, though Trust Women Women's Health Clinic says there are more similar bills in the works.
Maybe more pressing of a concern are the SB 8 style bills that are going through the chambers right now.
House Bill 4327 outlaws abortions after conception, unless it's to save the life of the mother or the pregnancy is a result of rape, sexual assault, or incest. And Senate Bill 1503 is the new Oklahoma Heartbeat Act. Right now, some states still offer abortions up to 20 weeks, including Oklahoma, which makes Oklahoma and even Kansas places where women can choose to end their pregnancies.
Do you think that
it will kind of ripple effect to other states. Like, since you are based in Kansas, you have a Kansas clinic. Have you seen an influx of patients already with just, in the week that it's been, approved?
No, we've seen an influx of patients in the 7 months since SB 8 has been in effect. Beginning the day before September 1st, August 31st, when SB 8 went into effect, our phones started ringing and they have not stopped since. We average over 500 phone calls a day to our clinics. Sometimes we're reaching 100 calls an hour. Both of our clinics are now majority out-of-state providers.
Some Oklahoma hospitals are in strict opposition to abortion, and in the U.S., hospitals that advertise themselves as Catholic, like Mercy and St. Anthony's, must follow a set of medical directives written by the U.S. Conference of Catholic Bishops. According to the Ethical and Religious Directives for Catholic Healthcare Services, it says, quote, Catholic health institutions are not to provide abortion services, even based upon the principle of material cooperation, end quote. And on Mercy's website regarding abortion, it states that contraception and termination of pregnancy are not provided, and also states they will instead provide counseling and clinical services to help a woman with her final decision. This can in turn lead to an increase in pregnant people traveling out of state to get abortions.
Even if Roe v. Wade is overturned, what is your prediction for the future in your professional opinion?
What we are seeing in the region in states like Texas, Oklahoma, is what happens when you choose the other path. When you force people to leave their communities during a pandemic, when you create a situation where being pregnant is punishment for having sex, right? When you are saying to people that they're forced to bear children that they don't want or that they can't care for. There's no given future for this. It's a matter of we're going to have to choose what really matters.
In Oklahoma City, Eden Jones, Studio Central.
As many know, a large number of the Oklahoma population identifies with some religion.
That's right. Studio Central reporter Brinley Linehan looked into how some local churches in the area view abortion.
CO being in the middle of the Bible Belt, there's a church nearly on every corner, and even one on campus, the Wysong Chapel. It's no surprise that there are many religious groups on campus, including the Wesley Ministry. Wesley is associated with the Methodist Church located near campus.
The Wesley Center is a college ministry with UCO, and we're affiliated with the United Methodist Church.
Abortion is a topic that many associate with religion. However, the Wesley Ministry has a middle-grounded opinion.
There's more conservative people that are United Methodists, there's more progressive people that are United Methodists, and there's also people that are just a lot of people that are in the middle.
The Methodist Church has their own opinion on abortion that directly correlates with their social principles.
I'm just going to read what it says on abortion. It says, while we understand the need for women to have access to safe legal abortion, we also mourn and are committed to promoting the diminishment of high abortion rates. We encourage ministries that reduce unintended pregnancies, such as safe sex education, access to voluntary family planning, contraception, and initiatives that enhance the quality of life for all women and girls.
The Wesley team believes in teaching students about safe sex, the various types of contraceptives, and family planning as a means to limit abortions. But they also just want to be able to give students a safe place.
We are just here to provide UCO students with a, with just a safe, strong, faith-based community.
The Wesley also offers free lunch every Thursday and a Bible study every Tuesday for any and all students. In Edmond, Brinley Linehan, Studio Central.
Our reporter Ben Anderson looked into the standards of sex education in Oklahoma's public schools and the experience of the students.
If you grew up in the Oklahoma public school system, chances are your sex education experience will sound like this.
They brought a pastor in to teach us about AIDS, but it was the scare tactic. They're like, if you sleep with one person, then you slept with everyone that they've slept with, so it's like that.
That is, if you even had a formal education.
I had zero sex ed in school, 100%. Like, I grew up in a town where the church is right across the street from the high school, and the parents threw a fit about sex ed. Like, they sent around a sheet for kids to have their parents sign about sex ed, and so few parents signed it that they didn't have to send it on.
The reason this may all seem inconsistent is because there is no state-mandated sex education program in Oklahoma, with the state leaving it up to individual school districts to decide how to approach the subject, if at all. Now, the state does require schools to teach HIV and AIDS prevention, primarily through abstinence methods. On top of that, several bills have been introduced to the state legislature in the past few years to advance sex education in schools. We have Senate Bill 89, which requires schools to provide health and physical education to students. On top of that, we have Senate Bill 926, which requires any curriculum related to sexual activity to include instruction on consent. Despite these advances, the lack of a state-mandated curriculum has led a few local health organizations to fill in the gaps.
So Thrive is the backbone organizing agency behind a big collective impact movement that's grown to encompass 38 partner agencies and 89 individuals, all committed to one single change and goal, which is to reduce the teen birth rate an additional 25% by 2025.
Even without a state-mandated sex ed curriculum, Thrive and its partners can actually use that to their advantage in some cases.
I experienced the way the policy is set up in Oklahoma, where it is like that. Pretty much the only mandate is going to be that HIV/AIDS education, which is pretty limiting, but at the same time, with it only mandating that one section, it provides an opportunity for like innovation at some school districts.
While Thrive and their partners are making strides in connecting schools and people with the resources needed to teach sex education, more work will need to be done to expand their reach past the metro areas and across the state. From Oklahoma City, I'm Ben Anderson, reporting for Studio Central.
Thank you, Ben. And in our next story, reporter Cameron Forrell talked to a survivor of sexual assault and asked how the latest abortion bills in the state impact survivors. And after the break, we'll tell you what resources are available on campus. Stay tuned.
If I could go back and change it all, I would. I think I'm gonna miss you the most. I'm sorry. I'm so sorry. I'm so sorry. Maybe it's just the little moments. If I could go back and change it all, if I could go back, I would. But I can't.
You can achieve a lot using your imagination. I mean, I don't like to brag, but... Wait, who's that? And why is she all over these achievement awards? But with STEM, the sky's the limit. Shaboom! Use STEM to envision... Okay, I'm seeing it. Yeah. Invent...
Got any ideas?
I've got a few, actually. And create a better world.
Told you she's super smart.
If she can STEM, so can you. Find out more at She Can STEM.
In the land of wonder and awe, you won't believe you see what you saw. Where there's something to do for young and for old, where stories are written and then they're retold. Visit Travelok.com today. Come see for yourself and come out to play.
Welcome back. Studio Central's Andrea Zuniga was able to provide some insight into how abortion currently impacts women in the Latin community here in Oklahoma City. Let's take a look.
Being raised in a majority Latino community, religion has a significant impact on the community's beliefs, one of those being abortion. Martha Lopez, who's at her old high school, has already gone through one with only close friends and her partner knowing. This year, she has chosen to keep her baby.
It does put, like now that I am pregnant, it does put a stop in your life. Whether you want to say yes or no, it does put a stop in your life. And sometimes people get really bad morning sickness like how I do. And there's times where I'm just like, shoot, like I should have just waited or something, you know, because
U.S. Grant is a school that has a daycare with the capacity to hold 35 babies. Pregnancy is already a normal thing to see growing up, but that doesn't mean that abortion is treated the same.
we live in a very Hispanic area, so I feel like a lot of that kind of is like traditional, you know, like on their aspects about abortion. So I don't think they're very for it as much as other people are.
There is also fear that this could not only lead to an increase of deaths of women, but children being mistreated in the foster care system.
I feel like either way, if a woman wants to have one, they're going to have one regardless, even if it's practical or not. And by canceling it, they're just raising up the deaths. Because there's so many kids already in the foster system with abortion already in practice. So imagine now.
This has been debated upon for more than 50 years and won't be stopping soon. There are multiple different perspectives currently giving their sides of the story, and it's important to listen to each. Stay informed, and from Oklahoma City, I'm Andrea Zuniga.
Resources for students can be found at the Center for Counseling and Well-Being.
And for more information on abortion in Oklahoma, visit ucentralmedia.com. And that wraps it up for today's special report.
Thanks for joining us.